Good morning. 3 local hospitals are getting a hand from UConn Health to stay open and to continue serving their communities. We're talking about Waterbury Hospital, Bristol Hospital, and Kimball Hospital in Putnam in the northeast corner of the state. Joining us to paint a picture of how that will all work at Kimball is the hospital's CEO, Kyle Kramer, and State Representative Pat Boyd, who was instrumental in all this. Welcome to both of you.
Good morning.
Representative Boyd, I want to get to you in a second on the logistics, but Kyle, I'm going to start with you. Why is this so important to the people in northeastern Connecticut? People in other parts of the state might say, oh, well, we'll just drive to a different hospital, we'll go somewhere else. But the people in your communities really rely on your hospital.
So they do. And for the people who live in northeast Connecticut, what this means most of all is the preservation of healthcare access in general. For people who live in northeast Connecticut, and we don't necessarily think about this, but it's far to go to Hartford. It's far to go to other places within the state to receive health care, because we don't have robust transportation systems, and a lot of the folks who live in our region may only have one car. So this is a big deal for them. It's a big deal for the people who work at Kimball, and I think it's a big deal for the UConn Health system as a whole.
All right, I want to talk to you more about what it can look like at your hospital, but Representative Boyd, let's go to you, because this is obviously Waterbury, Bristol, Kimball. We're talking about some large portions of the population of Connecticut. Right. Why is this necessary, and how logistically does this thing work?
Yeah, no, there's 2 parts to this. One is UConn Health long has been looking to expand its footprint. The Kane report from a couple years ago said that Farmington alone is not enough, and so through the governor's efforts and through OPM and through UConn, they've looked at what are good partners, right? At the same time, Kimball has struggled to stay afloat as well. It's done remarkably well, and so being able to add Waterbury, which was in the prospect bankruptcy phase, Bristol, which has great close proximity, and Kimball, that is in the northeast corner, makes a lot of sense. It grows the entire population. It adds more beds. It allows resources to get put through. So we passed a House Bill 8001 that puts the financing through the UConn 2000 program that sets that stage, and now it's up to the hospital CEOs and the boards to negotiate governance and to work out what the details of being part of a larger network looks like, with the money, the financing, and the bonding in place.
Now, we do have a statement from UConn Health. I want to take a look at that. We asked them about all this, and they gave us this statement. We are excited about the potential for Bristol and Kimball hospitals to become part of the new community network that UConn Health is developing. We will share more information on these discussions when it is available. And I guess, Representative Boyd, that's the thing, more information when it's available. We've got to work on how all the logistics
Right, this is the first step in the process. And obviously, Waterbury is going to follow different coming out of bankruptcy. But now all the pieces are in place, and it's the hope of Kimball and UConn Health that this is completed within a year.
Kyle, tell me about some of the things people might see if they're a usual patient or visitor at your hospital, because some of it's infrastructure stuff that the front-end users may be able to notice.
Right, and for us, one of the challenges of being small and rural is the ability to generate enough of a margin so that we can continually reinvest in capital projects. Some of those are manifested in the form of new equipment, maybe new beds, new monitors, those types of things, but there's a lot of offstage things that are important as well. So facilities become a bit of a challenge to maintain. Improving the facilities infrastructure, like replacing windows, replacing HVAC. Those aren't exciting things, but they're important things to keeping the building operational, and that allows our physicians and our staff to do what they do best, and that's take care of patients. But what it means for patients is that those services still exist, and we're continually able to provide those 24/7, 365. And we're excited about the possibilities that this brings.
And I know you've talked a fair amount about the technology piece of it too. Patients don't really care where their medical providers chart their information, but it makes it a lot easier for your folks to be productive when they have a state-of-the-art system.
It certainly does, and obviously there's a lot of the services that we provide today that we'll continue to provide on the Putnam campus, but when the need arises to send somebody for a higher level of care, and moving them to Farmington to the John Dempsey Hospital, information would then transmit seamlessly. So the team at UConn has access to the same information we have in Putnam in order to be able to facilitate that care. And then when the patient comes back to us, that information transmit back to us seamlessly as well. So there's a large system of information that goes behind the scenes that nobody really thinks about. But it's critically important to, number one, monitoring a patient's care, documenting what they're having done, and number three, understanding, are we producing the outcomes that we should, and how do we improve them?
Representative Boyd, tell me about your community. I asked you about the whole state, but for people who, your constituents, to not have to travel for care and to not see their hospital shuttered must be a big deal.
It's huge, and we've all followed along with other hospitals in the state that have been pared down or have closed significantly. We would have created a desert in northeastern Connecticut, with the nearest hospitals actually over the line into Massachusetts. This partnership is mutually beneficial. A lot of times you look at partnerships where it benefits one party or the other. The UConn Health system can grow. The proximity to the main campus and stores and the teaching opportunities for the nursing school that's there and a new facility are huge. And it maintains healthcare in a part of the state that would be very, very difficult to replicate.
And I know you said a lot of the logistics are still being worked out, but is the intention that Kyle's employees will become state employees, or it's more of a collaborative?
So the network is being set up amongst the three. So they're not going to be state employees. They're going to be part of this corporation, which is UConn Health, but with Waterbury, Bristol, and Day Kimball. So they'll still be employees of Day Kimball Hospital, but be part of a network. So they'll have advancement opportunities beyond just the Putnam area as well. And there's a bigger network of folks in those facilities that could potentially expand to Putnam.
And I guess just last question, that's a big deal too. I mean, we talk a lot. Every question's been about these people that you care for, but you got 1,000 employees up there too, and we got to think about them as well, I guess.
Exactly, and the reality is this: we can't do what we do for patients without that staff. So having access to academic training programs for physicians, for nurses, for pharmacists, for imaging specialists across the board makes a big deal. So number one, it makes it easier for us to recruit, but it also gives us the ability to provide ongoing educational opportunities for our own staff, so that they continue to learn, to grow, and improve in what they're able to provide in service to patients.
Well, and we know that service to patients, particularly in your geographic location, is such a big deal. And as you said, Representative Boyd, the idea that UConn Health needs facilities like this, it sounds like the perfect marriage of the two. And I guess we'll wait to see how the logistics play out. And a lot of people are going to be interested.
It's our homegrown, state-backed health center, and it seems like the perfect fit.
All right. Well, we'll see how it all shakes out as we work out the logistics. We appreciate you both being here, and hopefully we'll have you back once it's up and running and talk about more.
Sounds good.
Absolutely.